guest speaker today will give us a talk about equality and competitive advantage. He is a quality consultant at King Fahd Medical City. He's holding a bachelor degree in biomedical engineering from King Saud University and a master's degree in public health from University of Minnesota. He is a certified quality manager and certified as Six Sigma Black Belt and certified professional health and hospital administration. He will share his experience in the quality management, process improvement, and data analysis. Please join me to welcome Engineer Mohannad Al Kudwah.
السلام عليكم ورحمة الله وبركاته. بسم الله الرحمن الرحيم. الحمد لله رب العالمين والصلاة والسلام على أشرف الأنبياء والمرسلين. رب اشرح لي صدري ويسر لي أمري واحلل عقدة من لساني يفقه قولي. Thanks, Mr. Assam, for the introduction. I have to thank Amal Al-Damir, previous colleague, for this nomination. And thanks to all for this nice welcoming tour I had at the university. I'm sure that you are proud of it, as I am proud of it, just from one visit. Actually, if talking about quality, as we look into the elements, there's too many things that we will be talking about. But for the sake of time, I thought of focusing on something specific. And surprisingly, when I had the chance talking to Amal an hour ago, and she said, "You are talking about this issue." And I said, "Remember, that will be my presentation for today." So coincidence sometimes is nice. What do you see on the screen? Sorry? A rocket and one famous statement, it says, "On your mark." What does it say next usually? If you're in a field of sport, on your mark. Exactly, get set, go. Keep this in mind. That will not be the end. And the rocket, I'm delivering a message indirectly. So what we'll be covering, we'll get a quick insight about quality and why is it important and why it does matter in our life, data and statistics, and that will be my focus in specific. And there will be a take-home message. So, what is quality? If we are talking about general quality, we are talking about making things right, or how good we are making things. And actually, we need to focus on doing things right at the first time. Now, some people would say, what about the improvement cycle that we have to use PDCA, for example? Yes, when you do that part, you assess, but your final outcome is the actual goal for you doing things right at the first time. Why it matters? Actually, it matters for several things. The product you are delivering or the service you are delivering, it had to be durable, reliable, and the actual performance should be of a high quality standard and should be maintained and sustained over time. The actual sustainability is the actual continuity. Not to forget, قال الرسول صلى الله عليه وسلم, القليل الدائم خير من الكثير المنقطع. That's in doing things as a charity or whatsoever. Keep doing small things rather than doing one big bulk and then wait for another period of time or a break for a period of time. Quality itself, it builds a trust. How many times you like to buy the same product or going for the same vendor, as you trust that. And either you trust the service, you trust the salesman, you trust the product. So you keep coming back to the same issue again. And when you deliver good quality service, in general, you will be having less number of complaints. You might have some ideas. If the issues have been prepared, designed, listening to the customer, then you will be having less complaints from your customer, whether they are the students, whether your customer is an external body. And actually, let me take a quick break. When Mr. Assam was asking me to present something, I was thinking of quality within an education. With all my experience in quality, talk about 20 years approximately, I figured out that education quality is something new for me. I've been in the healthcare field, and I know, I would say, from A to Z about it. But when I opened some literature review to see what's talking about quality in education, and I found myself, okay, I'm a student. I have to learn again. I have to know too many things before I deliver a message for you. And when he said, well, it's actually for mostly graduating students, and I said to myself, okay, that's a relief, so I don't have to learn. I change it to something that you would be using in your career, inshallah. Why do we need equality in our life, in our work, in everything we do? Actually, if you are going into any industry after your graduation, you will see somehow quality in their activity. Whether being in finance, human resources, for example, marketing, you need to use quality in a way or another. In addition, you will find that there are a set of standards by accrediting organizations. Like, for example, the healthcare, they are talking about SIBAHI. Within the education, the NCAAA, that's an accrediting organization for educational organizations. In industry, you will be having something called ISO, or the ISO. They have too many standards, and so on. That would tell you that what you are doing complies with a standard. You are doing it right. Similar to any other thing, you do it according to a specific regulation with a standard. Some people say, well, I can do it anyway. Not exactly, because the standard came after experience, and they set up those methodologies for the best practices, whether being in healthcare or marketing. We can debate opinions, but again, it's part of the standard itself. The actual product, the quality management systems helps improving our product to increase the satisfaction of the people who receive that service or that product. It improves the morale and the motivation among the customers, whether being external or internal. It improves the morale, and actually it makes a clear structure with a clear responsibility, and actions is being set. So we know who is responsible for what. Then a quality product, you will be getting a better and increased sales for our colleagues in marketing. And with a higher profit and more customers, and obviously leads to higher customer satisfaction, and that would keep your current customer, or you can convince other customers to come back to you as returning customers, and those will be working as an advocates for your product itself. You are an example of Al University of Al Faisal. When you go out and say that I am graduating from the university, actually you are marketing for the university. So each one of us is an example of marketing for the university, as I used to do when I'm previous work. I work here and I work there, for example. So there are 6 domains or components of quality. We will not be talking about them all. I will be selecting one area, but we need to know that without leadership, there's no quality. Quality is not created from bottom up. Quality is being followed, implemented from top management all the way down through the governance. A clear strategy and goals are being set. System business rather than the hierarchy and organizational chart way of conducting business, and so on through change management, style of management, high-performing level 5 executive type of management, etc. The second component is the actual quality concepts. There are some basics that had to be learned and known for everyone as general knowledge. That would include what is the service, what is the product, what do we mean by process improvement or quality improvement, what do we mean by person-centered, which is the new focus of a lot of standards, rather than patient satisfaction or patient-centered. Now we're talking about person. That would include the patient or the provider, care provider. Similarly, in the healthcare, we're talking about the instructor and student, person. How do we integrate the aspects of quality from A to Z? And then what is the responsibility and accountability of every single member who is contributing to the quality improvement processes. The third component is the performance improvement. And we are talking here about the actual environment, quality environment, collaboration among the members of the organization, methodologies that being followed or the quality tools, risk, utilization of resources, measures and data that comes into leadership, measures and data as part of the performance improvement, measures and data as part of the data management, and that's what our focus of this presentation would be. Communication, team dynamics, team building, team collaborating and working together. The fourth component is the data. We talk about data management, collection methodologies, analysis, and then to translate that number or that data we have collected into information. And we'll come to some detail in this area. The fifth component is the actual quality tools. They are generally classified into idea generation tool, prioritizing and decision-making tool, management and planning, process tools, and data presentation tools. Now, within a couple of days, you could cover 90 to 100 different quality tools. They're all applicable. But again, how to use it, where to use it, when to use it, which area. It's the more you use it, the more familiar you will be coming for it, and the more techniques you can create when combining more than one at a time. Finally, when this big domains is the accreditation. Actually, it's the cream that you put on the cake after you produce it. It's the actual cycle to tell everybody that I am accredited organization. That means I have applied all the principles requirement, including leadership commitment, quality implementation, performing the assessment and the gap analysis, taking an action, improving, reviewing, and what's the most important part within the accreditation is the last element, maintain readiness and sustainability. I am ready every day. Now, those are the 6 main domains, but again, when you come back to some specialties, you have something different. In healthcare, you have patient safety. Similarly, in the industry, you have something different. If you are talking about educational activities, the actual content production of the curriculum. So you have some additional elements, but this is the basic. You need to apply those general and then translate it into how to perform your business using those basic elements in the details. Are we talking about quality or quantity, numbers? Well, quality saves money. Yes, you might be looking that you are spending extra, but actually on the long run, you are saving. It saves time. The rework you are spending, the re-evaluation, or the loss of time that you are doing things again and again, this is all counted as in business, that's money. It supports your sustainability when you have that cycle. Similarly, it reduces the stress among the people who are working. You increase the satisfaction among the people who are working with you, and the message from the management and the people working says, I care about everything. And I deserve that quality product. In line with that, quality items usually last. If you develop a system that has been studied using the right tools, usually it will be sustained and last longer than just quick ones with quick decisions. But in strategy or decision-making, you have different types of decision-making processes, some of which is done immediate and quick, and some of which should last long. That means you have to give it the right time to make that decision. What do we mean by data? And this is the core of our presentation. Data are numbers, and actually those numbers or measures, they are collected over a span of time based on observations. And those observations are different from type to type. And there are more than 10 types of observations, and we'll quickly go through this. What's important about the data is how do we aggregate and summarize data to be tracked over time and make use of it. The analysis of data is so important that you are developing and making information from these numbers you have collected. Without the appropriate analysis phase, your information is not valid, is not reliable. And you need to demonstrate with numbers that the information you have withdrawn from the data that you have collected is accurate. And you have to convince people using those numbers that what you are said is correct because of, etc. Simply, if I would say how many students are here, if I would count them, and there are, let's say, 30, this is a valid number. I have 31 students in the auditorium. And I can debate that. If we count them 1, twice, 3 times, 4 times, I'm going to get 31. So that's a valid, and I'm getting information. Now I can make analysis of it, whether it be in the space, the grouping, and the background, education, etc. But I have to have a solid number and a solid base. This data is always available in all specialties, whether it be in finance, administrative, human resource, process, clinical, anything deals with numbers. And without those numbers, your decision-making process in general will not be accurate. Talking about quality decisions. So in your data, you have 3 levels of data. This is my classification. You might find it, you might not find the same. You have the strategic data. That would be either a KPI or an OKR, key performance indicator, or outcome key results. You have a program or project data, or you have a process or quality improvement data. All of them, they have to follow the same way of data collection. You have to start with the extraction, and then the replication, ingestion, storage, etc. Cleansing, presenting, analysis, transforming it to information, making use of it, validation. Now, once you've done this cycle, your data is solid, bulletproof that you could use. Now, go for the next step. In the presentation, I started with the strategic data, and that's the logic. But I'm going to skip this slide, go for the second one, and then come back to this one. I'm going to start with the program or project data. Why? Supposedly, those programs and the project data are supposed to be built on the strategy of the organization and will be part of the strategy of the organization, because you cannot have a program or a project that's not in line with the organizational strategy. So your regular data management for a project may result to be elevated to a strategic level, or it could be at the level of the program. But the cycle for governance, definition of that measure, the collection, verification, validation, cleansing, analysis, and visualization comes to an end in the same way the strategic data would be. In addition, you need to look into some traditional benchmarking, whether with an external organization or internal, or comparison. But, quick example, never compare with any organization until you are sure that the same methodology of data collection with the other organization is identical, not similar, identical. I'll give you a quick hint. One time in healthcare, we were comparing our results of infection with another organization, specialty internationally. I think the hospital was from Sweden or Denmark. The first quarter and the second quarter, the organization is reporting 0 infection. In reality, that's impossible. Our organization was reporting as an average of 0.9% of our surgeries have an infection. In the US, they were talking about 1.2, 1.3, so we're doing fine within the acceptable limit. So the infection control, we were debating, I said to her, there's no chance. There's no chance. 0% in 2 quarters, I will not buying. The first thing I came up with, look at the definition sheet, what they are collecting actually. And that was the input. Let's say that they have 5 types of procedures being performed, 3 of which usually have infection. So they have excluded from the definition the routine infection that happens, and they are only monitoring where the infection should not be, and they would report it. Well, that's incomparable. I cannot compare myself with an organization like that. So when you compare your results with somebody else, don't take it for granted that the results are collected based on the data collection sheet in the same environment and the same criteria that you are following. Go into the details, and then you could say yes or no. And that's why when you compare yourself with your data over time, is more accurate than you are comparing yourself with others, because you don't know how do they collect their data. So when you elevate this to the strategic level of data, your data now is linked to the strategy. Basically, you are building your strategy and following down, but that's why I started with that one. And then your data from the program will be reported to the strategy and leadership level, and they can make decisions whether this is something strategically important or it's just a project data. And then it had to go through the same data analysis team or different team. They can make either change, cultural change, they will adopt the results, make changes strategically for improvement, whatever they want as part of their strategy planning and the goals, objectives set by the leadership. Finally is the actual process and quality improvement data. This is a lower scale, not importance. They are as important as others, but they are usually result from a quality project improvement or a process improvement, where you also still had to define what you are measuring, how to measure it, what is the project activity you are performing, and first of all, is it available? Do we need to count it, or how to be counted? What's my baseline? Is it my results in here, or I'm going to start from a previous data? What is the process that I'm trying to improve? And then it had to have a duration. This type of data must have a duration with your quality project. It had a starting time and ending time. Sometimes this quality project may end up to be a higher level, and that type of a program will continue. And sometimes the leadership even will escalate it more to be a strategic project. It depends on the result. Again, that classification of the data could be up and down, depends on the vision and the mission of the leadership. Now, anytime when you're talking about data, you're talking about facts. Fact is something could be proven easily. As we talked a while ago, the number of people, attendees in this auditorium, I can count them, that's a fact. That's based on data. The information usually is a translation of this data to something useful for the end user so you can make a decision, or it will answer the question. For example, how many male and female students we have in this auditorium? So after the count, I'm getting some facts, and I can tell there are X number of female, X number of male students. Now this is a fact. I can debate. Now it's making information. But I need to make use of this information for something specific. Why I'm asking. Some of the messages that I will deliver, I'll keep it to the end, which is the take-home message. But why I'm asking how many for each? Just general knowledge, or there's a reason behind it? Again, why we are collecting. Our colleague in here is from specialty, different from our colleague sitting at the back. It's different in here. So do I need to know the faculty students attending this class? Yes. Why? You need to answer the why when you're making data collection. There should be a purpose for this. You're not just counting numbers. There's a purpose for it. Well, I need to know how many students from that specialty. Who is interested? Is it something that will be accredited as an educational hour? They would like to have more knowledge. There should be a reason for directing that type of data collection to know who's attending and why. So when you have information, piece of information, it means that you have some numbers in it, some data. But the actual number per se, by itself, doesn't include anything. Okay? It just tells you a number. Population of Riyadh City is 7 million. Okay. So, it's just a number. Now, translate that. Afterwards, from this 7 million, for example, population, you need to know there are how many cars owned by the people in Riyadh City, the streets, the stress, travel distances, utilization of resources. Now I am making information out of this 7 million as a number. But the number itself, without any plan for it, is just a number for me. Now, there are two types of statistical data that we need to keep an eye when we are making some data collection, either continuous or discrete. Now, some people in the statistics or studying math, calculus, etc., they will speak better than I would do in here. But could I have 1.5 students? Okay, that's discrete. Your weight is 70.5, that's continuous. So anything that have a fraction is a continuous number. Anything that's discrete, you take it as a whole. I cannot have half classroom. Now, technically I can divide this into half male, half female, but that's not half classroom. I cannot have half baby unless, born half. I'm not sure whether we call him half human, but there's no chances. Again, within the actual statistics, now the descriptive statistics, that these numbers describe the characteristics of the data that you have collected. It tells you about it. What does it mean in general? While inferential statistics, actually you are trying to make some calculation and interpretation, and you combine it with other numbers that will give you a different type of a result. And that will be called inferential. You need to know. So when you get some numbers, you need to ask, are those numbers the descriptive directly from the data collection, or they have been put into process and that's another result of it? That will make a difference for you when you make a decision. Now, talking about this, it will take a full day, not a full class. So just you need to make a full idea. When you get some numbers, is this descriptive, directly collected, and then you are making decisions afterwards, or it's already been processed, and that's a result of a process. You have qualitative data and quantitative data as well, okay? The qualitative data, it has no unit. For example, when you say the distance from this wall to this wall, if you say that's around 1, 2, 3, 4, 5, 6, 7, 8, that's around 15, 20, 18, 20 meters, that's a unit. So that will become to quantitative data because it has a unit. You can measure it, okay? How many students in here? I have 35 students. The qualitative data, usually it's something that you cannot give a criteria for it. As an example, single or married? Well, single, okay, married, what's the unit? There's no unit. When you convert that number, saying how many married people in here, now let's say 50%, 15 married students. Now, again, what's the unit? We know centimeter, kilometer, weight, distance, temperature, Celsius, degree. Those are units commonly, but single and married is not a unit. Similarly, when you're talking about first prize, second prize, what's the unit? Okay. Are you happy, satisfied, not satisfied? When you go for some purchasing or marketing, you have those smiley face and regular face and someone who is unhappy, and you have to click, you're happy. Happy face. Okay. What's the unit? That's qualitative. And we do count and we do collect data, especially when we do satisfaction from our customers. Are you satisfied? Yes, no. Now, actually, we are counting how many satisfied, but that's qualitative. Quantity usually would have, as I said, a unit, discrete numbers, 5 children, or continuous, like 3.5 kilo, etc. This is how do we classify our numbers. And it is important. When you do data collection to make a decision for a change, which is important in our quality field, you need to know, are you mixing up the data collection or not? Are you mixing or not? If you have a specific data collection tool, you need to describe it. And the more you describe it, and the more clear your description is, the more accurate the results you're going to have. Now, before the data collection, we need to decide, are we talking about the entire population or a sample of a population? Now, the 7 million population of Riyadh, can I make a survey counting all those 7 million? No. Can I go to some area, for example, Al-Badi'a, Hayy Al-Badi'a, or Hayy Al-Ghadir, or wherever, and that would be a sample for the population of Riyadh city? No. So my sample had to be from all areas as much as possible. And that would be a sample of a population. Okay, if my sample is small, you attending this class, 35, 40, what would be my sample? The entire population. If you ask a statistician, the smaller the sample, the higher the smaller the population, the higher the sample percent would be. But if you have 1,000, you can go for 200, 300. There are some calculations that will be done. What are the collection tools? If you remember, we talked about it earlier. The most known tools are surveys or focus groups, interviews, customer complaints, some documents, feedback. But if you look on the graph in here, you have 10 different tools that could be utilized, and it depends on accessibility, expected response, and how much you can get out of this questionnaire. And usually, if you have a question that will be answered yes or no, that's easy, straightforward. Happy? Yes, no. There's nothing in between. Well, actually, at the beginning I was okay, but the result was not fine. So what are you asking for? And this is where we come into talking and describing the data collection tool. Again, being from the quality background, when I get a call from X bank or a product, ask, are you satisfied with our product? I can sense, where are you heading? Half of the questionnaires, we know the answers ahead of time. Everybody is happy because it had been written and set in that direction. Otherwise, sorry, no graduation, as an example, which is not reality. So, describing the actual data collection, it goes into several questions that had to be answered and had to be answered in real details. The first thing is why. You need to answer everywhere in the steps why. Why you are making this data collection. Even why in this area, why in this specialty, why in this time. You have to answer what's the purpose of it, what's the outcome, what's the expected, why does it connect, how does it. You need to answer all that questions in the why element. If you are satisfied, then you can go with the second question. Who's going to collect it? And that who obviously would be answering the tool that you are going to use. Am I going to send students, for example, or graduates to make an interview? So I need to create the interview tool. Is it something that, no, we're going to post it as a screen and everybody will come, will key in his ID number and say yes, no? That's who? Me. Who's going to be making the data collection? Not to forget that those who are making the data collection, they have to get the required training to understand what they are looking for, especially if it's an interview, and to have the right answers for the questions that will be answered by the customer or the one being interviewed. And then the what refers to the specific research questions. What's the content of your data collection tool or the questions that you are asking about? What? The elements said, okay, your name, your biography, your background of education, the product you are using, satisfactory or not satisfactory. Do you have, okay, this is all the what. What do you want to use? What questions you're going to ask in your questionnaire or in your data collection tool? When? Is it a specific period of time? During the day? 24 hours? A week? A month? Which month? I remember one time before we have an incident when we are reviewing and comparing the results of our data, and we can see that the sine wave is being moving every year. And it's something that's not clear why the sine wave is being moving from year to year. The peak was in this month. Next year, the peak was in this month, or at the end of that month, and then the following month. And we start debating, I mean, what could be the causes? And if we had at that time, the when was accurate, we wouldn't have that problem. We used to collect the data in Gregorian, obviously. January, February, March, April, May, that's easy. And actually the data presented and collected was reflecting the month of Ramadan, which was moving 11 days every month, every year. And that's why we can see that the sine wave is being moving, which is not explained. But we realized that, okay, now let's reflect the data and make the cutoff time according to the Hijri date rather than the Gregorian. And the bell shape was identical almost every year. Okay, that explains it now. But it took a while to realize that the timing of the data collection was in Gregorian, and the event and the incident that we're talking about was moving because of the Ramadan. 6 hours time, less patience, less. So something is wrong going on. And that cannot be explained without knowing this fact. And then the actual duration of your data collection. Is it a sample for a time of 12 months? Is it a year for 5 years? Is it 10 years for a 50-year data? Again, you need to see historically. If you're making a decision for the future, the more data, knowing how is it being collected, the more accurate and more probably that you're gonna reach your decision in the right way, seeing the trend, where does it go? And the actual where are you gonna collect this data? Is it at the entrance of the university, as an example, entrance of a hospital, in a street, an OR? Don't ask someone before his evaluation if he's happy or not happy in his work. I mean, people will come back totally with a different message. He's waiting for his increment, an increase in salary, and you're asking me, are you happy? No, I'm not. After I get it, I'll tell you I'm happy. So the timing actually is also important in here. Finally, how are you going to deliver that data collection? Is it something that you're going to make people going around, or it will be extracted? Are you going to post it? Are you going to make it downloadable? You're going to have smartphones, iPad, someone moving around and say complete? Tell me how you're going to do that. Actually, a little joke in here. Before the W, first W, the Y, it used to be who, what, when, where, and how. And we used to call it as, did you get something or not yet? Without the Y, only this. 4 W's and 1 H. Do you get something? I don't want you to sleep, guys. Okay. 4 wives, 1 husband. So they said, no, get another W, so nobody will gonna look for that. All right. So similarly, of what we have described earlier is you need to think of that number going through filters. Those filters are, the first one, I'm counting for students. So if I am saying students, any student in here, Ustad Khudairi or Dr. Khudairi is not a student, so he's not counted. Our colleague in here is not counted. Isam is not counted. So are you a student? Yes, I'm gonna count. Sometimes I'm saying more criteria in my definition. We are talking about male students. Sorry, females. I didn't expect to see females in the class anyhow. I should have changed male or female, so you need to classify. I am talking about male. Actually, I need to put more criteria for the filter that I'm talking about graduating male students. Okay, I need to put an additional filter. I'm talking about Saudi or male term 1 graduating. So the more filters you put, the count at the end had to meet all this criteria, and that will become a data. That is all described with the 5 W's and 1 H. And the more you clearly define those, the more accurate your outcome and that will be your summary definition. But again, why we are counting this and why we are doing this? Manipulating data is something I enjoy it. Now I need some answers quickly. Any instructor in here or all students? No answer. And this means one of two things. Either or. Okay, I'm not going to focus, please. If you are in a classroom, or let's say news come to you, and somebody says, well, it's 50% graduating rate. That's bad, actually, honestly. 50% graduating rate. And I start making an assessment, asking why. I need just a feedback. Assam, what would you, give me one reason, for example. Why you think 50% graduating rate?
Hard questions.
Hard questions, that's fine. Doctorana, Stadana, what would you give me a question? An answer, sorry. Why do you think 50% graduating rate? Hard questions. Tough instructor. Ali? Not studying. Second row, first on the left. Yes?
Maybe because of the threshold.
Threshold of
the university.
Okay. High expectation. Language barrier. First one to the right, left. Pass. Pass. Last one on the left. Yes. Pass. Okay, another pass. ايوه كنت ابغى اسال اللي جنبك بس مش عارف اي صف هذا. تفضل. انت جيت على المحك. Students sleeping during the class. Okay. Yes, sir.
Don't we need to know the total number of students?
انت what are you in a hurry? Why you are in a hurry? Now imagine that this 50% graduating students, and you're making studies and asking everybody who graduated from the university making this study, and you end up in that class, there are only 2 students. One passed, one failed. That's 50%, right? But only 2 students. Do you think that it requires a complete project to know why? Starting with the why, because of the number, it's not justifiable at all. So your data collection here, once you see the numbers in percentages, look for the actual physical number. And if you look at the number, ask for the percentage. There's a lot of data that could be mixed, and you will be getting different messages because of that. Okay, now, take-home messages. Listen, guys. Quality is not an act. Actually, it's a habit. You need to live with it and believe in it every day. Quality is never an accident. It's always a result of an intelligent effort. Quality without the science of research and science is absurd. You cannot make inferences that something is working where 60% of data is missing or says it's not working. Without data, you are just another person with an opinion. Are you measuring what is useful, or you just want to know that you know how to count? You can have data without information, just numbers, but you would never have information not supported by data. Finally, the data science is not about the quantity of data. It's actually talking about the quality of data you have collected, how good and reliable it is. Keep those 6, 7 messages ahead. Remember them. You're going to have a copy in PDF, by the way, so feel free to share it. It's okay to take a picture. Keep this in mind as long as you go in your life. Anyone who's going to go into the career looking for numbers or working in an administrative level looking for numbers, keep this habit in the way you work. When you're looking at numbers, don't believe the first number in front of you. Always look and dig behind. Thank you for your attendance. Remember, how did I start the presentation? And I said, on your mark, and you said, get set and go. I changed it. I said, on your lane, get to the starting position, and start taking off. And that's why you have the rocket ready to take you off for the second step in your life. Good luck. Thank you. Allah يسلمك.
Thank you so much, Engineer Mohannad, for the valuable talk. Wait, guys. We still didn't finish. Please go back to your seats. Any question? Okay.
I have a question.
Yeah, please.
When I used to ask students, I give courses for 5 days, etc. And when I ask them, do you have any questions? Everybody's quiet. And I said to them, which I didn't say earlier, there's one of two reasons. Either you understand everything or nothing. Sorry.
Exactly.
No, I'm sure that you comprehend. But again, this is something that you have to live with to understand it. You have to practice it. Every day, a piece, that's fine. That's an improvement. Tafadhal.
Again, thank you so much. It was valuable and lovely to hear from you. And wishing to see you again, inshallah, in next or another speak.